Dear colleagues, welcome back to the Endo channel by Gianluca Plotino and to the part of this channel dedicated to not only endodontics, the not only endo session of this lesson 2020. This third lesson of this series will be dedicated to the comprehensive dentistry, and so will be dedicated to my approach to the patients from a 360 degrees point of view. So the background of this third module is always related to my approach to the clinical practice given by the multidisciplinarity. So my approach is, I'm not only an endodontist. In my clinic I always perform all the restorative part of the treatments, all the aesthetic restoration of my patients, preventive treatments, and all the prosthetic rehabilitations of my patients. So I dedicate my clinical activities to all these treatments, and also my research and my publication are dedicated on this. So we can speak in this case about interdisciplinary dentistry. And when we speak about interdisciplinary dentistry, we speak about multidisciplinary treatments. And the word multidisciplinary indicates solely that more than one discipline is involved in the treatments. So multidisciplinarity draws on knowledge from different disciplines but stays without their boundaries. So I always prefer to use the word interdisciplinary because it indicates an interaction between the involved disciplines. And in fact, interdisciplinarity requires a team which is highly interactive. And whereas the ability of the involved colleagues to treat is limited to one area, interdisciplinarity requires a high level of information, not only within one's own specialty, but also about the state of the art of all involved disciplines. In fact, if we want to perform a multidisciplinary approach, we obviously must have a basic knowledge of all the involved disciplines in our treatment plan, to directly involve the specialists in our treatment plan, or to execute the treatment plan ourselves, having the knowledge of what we are doing in a multidisciplinary basis. And this is honestly difficult to obtain a multidisciplinary approach and an interdisciplinary dentistry. This is very clinically relevant, but has some difficulties to be obtained. In fact, we have also some drawbacks of interdisciplinary dentistry. For example, the costs, the compliance with the treatment plan, the team composition, the patients that reject to be treated by different professionals, the timing, geographic problem with the people that we are working with, team conflicts or imbalance between workload and fees, personal efforts, and difficult and unclear communication. So for this reason, I'm always working with my associates in my clinic to a multidisciplinary approach, but I always want a multidisciplinary knowledge to understand what must be done on the patients, to define everything linked with the treatment plan, imagine what it must be done, and plan and perform it. So I always like to speak in my practice about a comprehensive dentistry. The comprehensive dental care provides for full range of dental health services, from diagnosis to treatment, follow-up, and rehabilitation of patients, in what I have always called a patient-centered approach. And today, in my practice, I have increased very much this approach, and a very big part in this approach, interdisciplinary approach, has been taken by the clear aligners. Because today we can treat with clear aligners patients with mild to moderate misalignment and aesthetic problems, and we can use as general practitioner systems that corrects the position of the teeth before starting the restorative procedure. So we have in our hands today a system that allows general dentists to integrate transparent aligner therapy with comprehensive treatment plans to meet patients' needs and transform patients' smiles in a simple, fast, and effective way. And so, We will see how this system that is specifically designed to be part of a comprehensive treatment plan can be used by us as general practitioners to perform a comprehensive treatment plan even without the cooperation with different specialists. And we will also see the advantage of this approach, increasing our mind and changing our mind, and how also it helps to involve the specialists and orthodontic specialists in this case to treat the most difficult cases that we cannot approach. This will be described in this third lesson on the Not Only Endo series in this web platform that is the Endo channel by Gianluca Plotino.